name is Andre Lemy. I'm a cardiac surgeon. I'm the program director for the residency training program in cardiac surgery here in Hamilton and then McMaster University. General is a huge hospital, actually. We do virtually everything in this hospital. And all the cardiac surgery, all the coronary angiography, all the cath lab, all the TAVIs are done here at the General. So it's a huge volume of patients. Our cardiac surgery program is not small. It's a small city, but it's not a small program. We cover the whole area of Niagara, Hamilton, Burlington, Brantford. So it covers about 2 million people. That basically brings us a volume of about 2,000 patients a year for cardiac surgery and TAVI. We do about 1,800 patients in the OR and about 250 patients in the TAVI lab every year. So it's a huge volume, probably one of the highest in the country.
Hi guys, my name is Saurabh Gupta. I'm one of the cardiac surgery residents at McMaster University. I'm just starting my 5th year. So that's one of the things, the hands-on experience is fantastic. I don't think any one of our residents would ever complain about that. Especially as you get seniors, they definitely ensure that you know the basics of cardiac surgery and are safe to operate, as well as some of the more advanced stuff as well.
We run 3 or 4 rooms per day, and usually we have 4 or 5 residents at the same time. So almost every day the residents are in the operating room, except the academic day, of course.
We have a tremendous clinical volume in this center, and Hamilton is based in the middle between Windsor, Toronto, and Niagara Falls. So we get patients from everywhere, and we get a lot of interesting material coming here. It's also a great place to travel to other places, and also there's a very upcoming arts scene and restaurant scene in this town.
I think for me, the 2 biggest things about McMaster that drew me here, first of all, the people. That is definitely #1 for me. The sort of sense of community and the amount of collaboration you see here is completely phenomenal.
Hamilton's an awesome city to be around. Not many people might think that, but if you want to get away with things, you can always, there's like 40 waterfalls around you, and you could go for a hike. And I personally love astrophotography. You could just drive an hour and it's pitch dark. You get to see all the stars.
The city of Hamilton could have a bad reputation, but this is so wrong. It's a fantastic place to live and to be. But also the quality of life is fantastic for our residents. So even if you live downtown, if you want to get out of here, within 20 minutes, you can be golfing, one of the best golf courses in the country, or you can be boating on Lake Ontario. You can be in the countryside, petting animals and watching horses and cows in the countryside. It's quite phenomenal. There's very few cities that actually you can have access to all of that within only 20 minutes.
Because we are such a small, tight-knit program here in the cardiac surgery department, there is definitely a lot of exposure that you get, especially even at a junior level, not just in the operative setting and in the OR, but also on the wards and the ICU setting as well. There's just so much to learn and so much to do.
McMaster University offers a very strong 1-year curriculum in clinical epidemiology, where we learn the basics of conducting research and also go along and conduct research autonomously.
It is one of the biggest centers in Canada in terms of volume. Also, I have to mention that our program has a unique way that most of our residents who went to the program has obtained at least a master's degree or PhD degree in the research field. So that will be a big bonus for whoever is going to join the program.
McMaster has been a place that I've been proud to call home for the past 8 years, and I've had the pleasure of both living in Hamilton and watching it grow to become the city that it is today, and it's very different from when I first started. There's so much to do. The golfing that you see here is really just one of those things that's in the close proximity. There's plenty of waterfalls, hikes, amazing new restaurants and bars that are awesome for socializing.
One of my hobbies is actually hiking and trekking and mountain climbing. And last year I climbed Kilimanjaro, and I've done tons of treks around the world. And coming to Hamilton, that was one of the fears, is am I going to get out there and keep hiking on a regular basis? And as you can see, that's definitely not in short supply here in Hamilton. So definitely anyone who's an outdoorsy person, I would urge you to check out Hamilton. We're not all about Steeltown. There's a lot of outdoors here.
Hamilton is a wonderful place. We have the largest adult cardiac surgery program in the whole province, and there is a wonderful mix of various clinical cases.
So I tell my residents, you're going to work hard. Yeah, this is cardiac surgery, and we will teach you well. But also, you will enjoy working with residents. We have an excellent group of residents.
I've been working with the residents for now since 2008. That's when I became faculty here, and it's been a great pleasure to see the program mature and grow. We have a great academic experience in our program, great clinical experience, and we look forward to meeting all future candidates and training the future cardiac surgeons within Canada.
At the end of the training, at the end of their 6th year, all our residents are actually ready for their own independent practice. They get excellent, or I believe, excellent training here at McMaster.